Assalamualaikum and a warm good morning to all. I am Bushra, biology teacher of Senior Secondary School AMU Aligarh. Today I am here to discuss one of the topic of the class 12, that is genetic disorder. The genetic disorder is the vast term, so I divided my lecture into two parts. In the first part, I considered the chromosomal disorder, and in the next one, it will be the Mendelian disorder. So today's lecture, I include some of the topics, that is introduction of the genetic disorder, the chromosomal disorder, and the types of the chromosomal disorder. So without wasting much time, let's come to the main topic, genetic disorder. So first of all, tell me, what do you understand by the disorder? The term disorder means dysfunctioning. In biology, it is the dysfunctioning of any body organ. Suppose if someone's kidney is not performing well, then he or she may suffer from the kidney disorder. Similarly, if someone have disorder or the dysfunctioning in their genetic material, then it refers to as the genetic disorder. So the term genetic disorder means the disorders or the abnormalities occurs in their genetic material. So what is the genetic material of human being? In human being, the genetic material is DNA, whereas some viruses, there the genetic material is RNA also, but in human being, the genetic material is DNA. So, genetic disorder means the abnormality in the person's DNA. Okay? Come to the next slide. With the help of this flowchart, I hope it will be clearly understand what is genetic disorder. The genetic disorders are of two types, the chromosomal disorder and the Mendelian disorder. Chromosomal disorders are the disorders which occurs due to change in the number of chromosomes. It occurs due to change in number of chromosomes. Here, the chromosome number may be changed. It might be the addition of the chromosomes, or it might be the deletion of the chromosomes occur. Okay. On the other hand, the Mendelian disorder, also called as the gene-related disorder. Here, the changes occur or the mutation occurs at the gene level. So, Mendelian disorder we will discuss in the part second. Today, we focus on the chromosomal disorder. So, before explaining the chromosomal disorder, I want to clear your concept about the chromosomes. Okay. So, what do you understand by the chromosomes? Every human being have 46 chromosomes. Every human being have 46 chromosomes, or we can say we have 23 pair of chromosomes. Out of this 46, the 44 are the autosomal chromosomes. What are 4 chromosomes are autosomes, whereas 2 chromosomes are allosomes. So what is autosome and what is allosome? The autosomes are the set of chromosomes which is same for male and female. Okay? So autosomal chromosome means the set of chromosomes which is same for male and same for female. Whereas on the other hand, the allosomal chromosomes or allosome chromosomes, also called as the sex chromosome. It is different for male and female. Okay? Allosome is different for male and for female. In male, it is X, Y, and in female, it is X, X. These are all about the chromosomes. I hope you clearly understand how many chromosomes we have, because it is the number of the chromosomes we have is very important for chromosomal disorder. To understand the chromosomal disorder, you must know about how many number of chromosomes we have. Out of which 44 are autosomes and 2 are sex chromosomes or the allosomal chromosomes. Is it clear? Okay. Now one more thing about the chromosomes is that genotype. What is genotype? The genotype of normal human being. Genotype of normal human being is 44XX and 44XY. What is it? 44 is the number of chromosomes that are same for male and female. That means these are the autosomal chromosomes. Whereas the XX and XY are the sex chromosomes or the allosomes, which is different for male and female. Hence, that's the reason the genotype of male and females are different. Here it is the XX44 is the same for all, so we cannot differentiate on the basis of this allosome which one is male or which one is female. How can we determine? We can differentiate on the basis of the allosomal chromosomes. Okay, so it has XX means it is the genotype of female, normal female. Okay, it is the genotype of normal female. And here the allosome is XY, that means it is the genotype of normal male. Why I say normal? Because later on we will discuss about the chromosomal disorder, so we can understand the genotype of the disordered person is not same as it is. Okay, so it is all about the concepts of chromosomes. Now comes to the disease one by one. As the chromosomal disorders are of two types. On the basis of the types of chromosomes, the chromosomal disorders are further divided into autosomal and allosomal. The autosomal disease disorders are Down syndromes. Allosomals consider the Turner syndrome and Klinefelter syndrome. The Edwards syndrome is the examples of the autosomal chromosomal disorder, but it is not in your syllabus, so we will not discuss in detail here. So we discussed in detail about the Down syndrome, Turner syndrome and Klinefelter syndrome one by one. So let's start first the Down syndrome. Down syndrome is the autosomal chromosomal disorder. We also know this about with the hyperflow I told you that it is the autosomal chromosomal disorder. Okay, means the changes occur at the autosomal chromosomes. What type of changes occur? Addition or deletion. So it is also called as the 21st trisomy. The term tri means 3. It means there is in the autosomal Down syndrome, there is the addition of one extra chromosomes will occur. Okay, fully or partially the extra chromosomes will be here in case of Down syndrome. Now, in which type of chromosome? Autosomal chromosome. How many autosomal chromosomes we have? 44 autosomal chromosomes we have, which is same for male and female. So, which number of chromosomes or which pair of the chromosomes we have an extra chromosome? So, it is 21st. So, clearly the 21st trisomy means one fully or partially extra chromosomes was added on the 21st chromosome. It's clear? The Down syndrome has one more or extra additional of chromosomes will take place on which type of chromosome? Autosomal chromosomes. At what number? 21st number. So, Down syndrome is also called as the 21st trisomy. It is discovered by the Langton Down in 1866. Now, can you tell me what is it? 45XX and 45XY? Simply, it is the genotype. It is genotype. I told you the genotype of the normal male and normal female. Normal male it is 44XY and normal female it is 44XX. Okay, it is for normal female and it is for normal male. Now, here the genotype is 45XX and 45XY. It is XX means it is for female, XY means it is for male, it is male. Now, what is the 45? 45 is the number of autosomes. Normal cases we have 44 autosomal chromosomes, both in male and female. But in case of the Down syndrome, we have 45 number of chromosomes. Why it is so? Because there is the addition of one chromosome takes place on the 21st chromosome. So now overall we have the 45 autosomal chromosomes and 2 sex chromosomes are same. So these all are about the Down syndrome. I hope it is clear to you. Now look at this picture. It shows the symptoms of Down syndrome. What are the symptoms of Down syndrome occur? In the Down syndromes, their height will be shortened, okay? Their growth failure, there should be a mental retardation, okay? Their IQ level, their intelligence level will be disturbed. It has some cardiac disease, heart also not performs functions well. there must be the congenital heart disease. Okay. There is flat back of head. The back of the head will be flattened. In this case, the tongue was protruded. Okay, the tongue was protruded. The eyes was slanting. The slanting eyes, it is just like this. The eyes was slanting. Broad, flat face. The proportion of the face and the body was disturbed. The proportion of the face was broad in this case. Then there is the many loops in their fingers and palms. We have normally the 2 or 3 loops, but there are many pieces in their palms and fingers. Many loops are there. Then there are various special skin ridges patterns. Then absence of one rib, unilateral or bilateral absence of one rib. Intestinal blockage, the digestive system will also disturb because there is the blockage in the intestine. Then umbilical hernia will be there, abnormal pelvis. The toes is bigger and there is the much space. The space between this is much. Then enlarged colon, congenital heart disease, dental abnormalities will be there. Small and arched palate, big wrinkled tongue which is always protruded. Then short and broad hands, short nose, epicanthic fold, eye fold. There is the folding in the eye fold. Slanting eyes and broad flat face. These are all the symptoms of the Down syndrome. The person suffering from the Down syndrome has all these symptoms. Okay, it is all about the Down syndrome. I hope it is clear. Now come to the next slide. That is Turner syndrome. So Turner syndrome, it is the sex chromosomal disorder. It is the sex chromosomal disorder, or we can say it is the allosomal chromosomal disorder, because allosome is also called as the sex chromosome, which is different for male and female. Again, as it is the chromosomal disorder, means there is the change in the number of chromosomes. What type of changes occur? Either addition or deletion. So in this case, it is monosomy. Mono means one. Here, only one chromosome is left. That means there is the deletion of one chromosome occur. So normally we have sex, how many sex chromosomes we have? 2 sex chromosomes. Okay. In male it is XY, in female it is XX. It is for male and it is for female. In this normal cases we have this type of sex chromosomes. But the person who suffers from the Turner syndrome will reduce one sex chromosome, that is one X chromosome will be deleted, and it occurs only and only in female. So the female will suffer the Turner syndrome. Male will not suffer the Turner syndrome. Okay. So these are the disease which occurs only in female. What will happen in this? There is the deletion of X chromosomes. Now what will be the genotype of it? Is there any difference or is there any disturbance in their autosomal chromosomes? No. The number of autosomal chromosomes is same, 44. Then what is the changes? The changes will occur in the X naught, means there is the absence of X chromosome. Okay. Normal genotype of the female is 44XX. These are the autosomes and these are the sex chromosomes. There are 2 sex chromosomes are there. But in the Turner syndrome, it is 44X naught. X naught means there is the absence of one X chromosome. Okay. So the genotype of this is 44X naught. It occurs only in the female, and the female will become sterile. Why? Because the defect occurs in their sex chromosomes. So their fertility will be disturbed. So she becomes sterile. Okay, she is unable to conceive. Treatment. This occurs due to the deficiency of FSH and estrogen hormones in the body. So we given the externally FSH and SH. Treatment will be discussed in the next slide. Now comes to the symptoms of this. I hope it is given by Turner. I hope these all are about the Turner syndrome, which you cleared. Now come to the symptoms of Turner syndrome. What are the symptoms? There is again the short stature, means the height is shortened, just like the Down syndrome. But Down syndromes and Turner syndromes are very much different, because Down syndromes are the autosomal chromosomal disorder and Turner syndrome is the sex chromosomal disorder. Okay, but in both cases the height is shortened. Next, as it occurs in the female, then female secondary sex character will be disturbed. So what will happen? There is the low hairline. There is shield-shaped thorax will be there, widely spaced nipples are there, short in metacarpal fold, small finger nails will be smaller, brown spots on navy. Okay, facial, if you see the characteristics of the facial, then again the slanting height will be there, nose was short. Okay, fold of skins are there, constrictions of the aorta means there is some how it is related to the heart disease. Okay, then poor breast development. Breast development is the characteristic of the female, so there is a poor breast development. Elbow deformities will be occur. Rudimentary of the ovary. Due to this, the female will become sterile or infertile. Why? Because their reproductive tract or reproductive organ will be affected. Their ovaries was rudimentary. They reduce the size of the ovary. Their gonadal streak or underdeveloped gonadal structures will be there. Their gonads was not performing well. As this is the reason why it is occurred, because FSH and estrogen will not will be insufficient. So in this case, these are all the symptoms of Turner syndrome. These are the, what is this? It is not the genotype, because here the 45 is the full number of chromosomes. Normally we have 46 chromosomes. In normal cases, the human beings have 46 chromosomes. But in this case, the one chromosome was deleted. So now we have 45 chromosomes. Out of 45, the genotype is 44 44 and X not 44 plus 1, that is 45 chromosomes are there. Okay, so don't be confused with this. These are the total number of chromosomes. And these show the deficiency or the monosome of or absence of one X chromosome. Okay, it is rare. Say 99% of cases was aborted. In this case, then 1 in 2,500 or 1 in 200 live-born females are there. Means there the chances of the baby born with the Turner syndrome is very much less. Okay, normal intelligence. She in the Down syndrome we discussed that she has the he may have suffering from the mental retardation, but here intelligence is not disturbed. They have normal intelligence, but she may show some problem in the 3D spatial problems and math problems. Okay, but normally their intelligence level is normal. So these are all about the Turner syndrome. Now come to the treatment. Treatment, as I told you, it is because of the deficiency of the estrogen and FSH hormones. So we externally given the FSH and estrogen hormones to the female who suffers from the Turner syndrome. But giving to these hormones will not cure their infertility or sterility. The female will still sterile, but she may feel normal, she can live normal, but their infertility will not be curable at this treatment. Okay, the breast develop and have menstruation, because in this case the female will have some problem in their menstruation. Their periodic cycle is not normal. So after giving this FSH and estrogen, the menstruation will be there, breast will be normally developed, but infertility will not be cured. Okay. So these are all about the Turner syndrome. Now come to the Klinefelter syndrome. Klinefelter syndrome again is the sex chromosomal disorder. Chromosomal disorder means change in the number of chromosomes. Which type of chromosome? Sex chromosome. Again, we have two types of the sex. What type? XX and XY. So this type of chromosome occurs again in the X chromosome. What happens in this case? It is the trisomy. Tri means 3. So what will happen in this? Either the addition or deletion of the X chromosome. Simply, here is the addition of one X chromosome. Addition of the X chromosomes will be take place. So how many total number of the chromosomes we have? Normally we have 46, but in this case, how many normal chromosomes we have? 47. Why? Where the one X chromosome comes from? The one is extra X chromosomes will be there. So what are the genotype of this? Here the genotype. Is there any changes in the autosomal number of chromosomes? No, because it is the sex-related disorder. So there is no changes occurs in the autosomal chromosome. The genotype will be 44 is the autosomal chromosome, and the changes occurs in the X, and Y. Yeah, this occurs only in male. So there is a difference. The Turner syndrome occurs only in female, and the Klinefelter syndrome occurs only in male. Okay, so genotype will be 44XXY because normally the genotype of male is 44XY. But here total is 44, 1 and 2. Yani 46 chromosomes are there, but one extra chromosome is one more extra chromosome is there. So the genotype is 44XXY. Okay, given by Klinefelter syndrome occurs in male, and in this case the male will become sterile. Okay, what happens in this? Let's show some symptoms of this Klinefelter syndrome. In this disease, there is not the height is not shortened, even the height is taller. Why? Because their arms, their legs will be longer as normal size. Okay. Then frontal baldness will be absent. Yes, one more thing is here one X chromosome is added, so they show some feminism character. Okay, what are the feminism character? That sparse beard growth, their patterns of hair growth just like the female, their chest must not have the much hair, their patterns of the pubic hair is same as the female, their breasts was not fully developed, their breast was more developed as like a female, which is called as the gynecomastia. In 30% cases, the male's breast will be as like female or developed. Okay, failure to grow or tendency to lose the chest hair, narrow shoulder, okay, just like a female. Their pitch also changes. Arm span greater than height, that why their stature is tall. Okay, wide hip, just like female. Family distribution of the pubic hair, small firm testes. Here they are sterile because there is some disturbance in their reproductive tract again. So what are the disturbance in the reproductive tract? Their penis is small, their testis is small, they have long legs, they are azoospermic or oligospermic, means the number of the sperm produced is much less or absent. They are unable to produce the sperm or the male gametes. Then learning disabilities will be there, osteoporosis is there, less muscle mass compared to the age matched control. Their stature will be long because they have the long limbs, and increase the risk of metabolic syndrome, means he may have risk to suffer from the diabetes 2 to second type diabetes. They are hypogonadism, means there again the gonad will not secrete the androgen as such as normal secrete. Okay, there is absent or delayed or incomplete of the puberty, mildly impaired IQ. Their IQ level is disturbed but not too much. It is mildly impaired. Okay, slightly feminine physique. What physique? Like their development of the breast, rudimentary in the penis and testes, and their forming pitch just like a woman. These are all the symptoms of the Klinefelter syndrome. Now come to the treatment of this. Just like Turner syndrome, it again we can treat it but not cure the sterile or infertility of the male. In this case, again the male can live normal, can feel normal, their breast will become at the normal size, but their infertility will not be curable. In this, we giving the androgen because they are the gonads are not produced properly, so we give androgen externally. These androgens will help the breast to return the normal size, but he can feel normal but not cure the infertility. Again, the infertility is not cured by this treatment. These are all about the genetic disorder. I hope it is clear to you what are the genetic disorders, what are the chromosomal disorders, how many types of the chromosomes are there, what are the autosomal chromosomal disorder, what are the Klinefelter, what are the Turner syndrome. These are all about. I hope you can understand all this for today. Thank you.